Welcome back to The Bridge on WSAV. You've heard us talk a lot about chiropractic care here on The Bridge, and that's exactly what we're going to be talking about today. We're at the Joint Chiropractic with one of our experts, Dr. Ryan Shaw. Hi, Dr. Shaw. It's great to see you.
Hey, Miss Natalie. Nice to see you as well.
So chiropractic care, it's something that really can improve your way of life. But some of our viewers maybe they've never been to a chiropractor. How do you explain what chiropractic care is all about to a new patient?
Right. Well, Natalie, I usually go one of two ways, okay? The first is very similar to how a mechanic might talk about the alignment on their vehicle. Okay, so everybody's been driving down the road and that car is just pulling a little bit to the left, right? So we know that the weakest point is going to start to wear and tear faster than any other part of the vehicle, right? So that's going to be that left side of the vehicle, okay? Well, your spine's very similar in that we have weak points, okay? You have a hard bone on a soft disc, on a hard bone on a soft disc. You know, if you have a couple of those bones that are misaligned, it's going to start to wear and tear at the softest point, that disc, okay? And over time, every time that you bend and twist and turn and the sitting and sitting at a computer desk, it's going to wear and tear at that disc, and eventually we'll get to the point where we have pain. Right.
So you'll start feeling some type of symptom over a period of time. And, you know, sometimes I think I've even realized that you don't even, sometimes realize that you're leaning one way or your body just kind of adjusts to that way until you do feel some type of pain that goes along with it. But that's where you guys come in.
Absolutely. And the research actually says that it can take up to 10 years for that misalignment or that problem to be there before we actually experience enough degeneration or enough damage to experience that level of pain.
So let's talk about some specific conditions that you can see where chiropractic care can really help and is needed.
Right. Well, we all know that chiropractic can help with low back pain and neck pain and headaches. The research has this as the gold standard or the go-to for those specific conditions. But because of that intimate relationship that your spine and your spinal cord have with your body, we can help with so many things just beyond the levels of pain. Okay, so what part of your body does your brain control?
Well, I would think that your brain controls your entire body.
Everything, right?
Right, okay.
Every single muscle, cell, tissue, and organ in your entire body is controlled by your nervous system. And as you improve spinal function, your nervous system is going to improve because your nervous system and your spine is literally running down the center of your spinal cord, right?
And if something's off, then everything is off in some capacity.
Absolutely. We're going to put pressure and tension on those nerves as we have misalignments, okay? And that's going to affect your brain's ability to communicate effectively with the rest of your body.
And I'm just amazed at how well that you guys do here. And because, I was actually a patient and was adjusted, and I hadn't been adjusted in a very, very long time. And I was amazed at the relief I felt in my neck. It was amazing. And it was a little scary to hear that sound, of course. But of course, we know that that's not bones breaking.
Right, no, not at all. That's only the gas being released from that joint because it's been stuck for so long, okay? We got to make sure we have good mobility and motion in those joints so that we don't wear and tear at those cushions or the soft tissue in between each of the bones.
So when it comes to chiropractic care, is it an alternative form of medicine or of healthcare? Is that?
Yeah, and I hear that all the time, and I would say yes, in the sense that we're coming from a completely different perspective. We're thinking about things totally different than the medical world, because medicine and the medical community, they're trying to relieve or take away a symptom.
And some medication is definitely needed in the medical field. We realize that.
Absolutely.
But sometimes when you're dealing with something like a symptom of pain, people can go overboard and even get addicted.
Absolutely. Obviously, if we're in a crisis situation and like we have extremely high blood pressure, we need to get that blood pressure down.
Right.
Okay. But what happens if we decide that we stop taking that blood pressure medication?
Well, when you stop taking it, your blood pressure is going to go right back up.
Exactly. So we know that we're not fixing the cause of the problem. We're actually just kind of covering it up or masking the issue.
That's where chiropractic care can really come and really help your way of life, your patient's way of life.
We should really be a primary source of healthcare instead of reacting to a crisis situation. We want to keep you from ever getting into a crisis situation when it comes to your healthcare.
So what ages start chiropractic care? I mean, because a lot of people think, oh, well, when I start to feel pain later in life, that's when I'll start going to a chiropractor.
Sure.
But that's not it at all.
No, absolutely not. Everybody has a spine, right? Even from day one, during the birthing process, there's a lot of pulling and twisting and turning that can happen. And what's the first thing that you're taught about when you're holding a baby infant? You're supposed to support their head and neck, right? Because they don't have very strong neck muscles.
Right.
They can't hold their head up. So
Right.
we do a lot of twisting and pulling and turning, and that can cause a lot of damage that we've seen.
If someone starts chiropractic care, is it something that you have to do for the rest of your life?
Okay, well, you're going to get the benefits of chiropractic care as long as you utilize it. Okay, it's kind of like when you go to the gym. How often do you expect to see the results of going to the gym? It's not an addictive form of healthcare by any means, but we definitely, in order to see the results and the benefits of it, you have to keep going.
I want to thank you, Dr. Shaw, for joining us and for sharing the information that you did about chiropractic care.
Well, thank you, Ms.
It's always great to see you.
Pleasure.
If you'd like more information on the Joint Chiropractic or any of our Coastal Experts, just check out our Coastal Experts page. You'll find that at WSAV.com.